how do you decrease inflammation?
Mm-hmm.
Because inflammation is such a big piece of what we're talking about here. The metabolically active visceral fat, the idea of this accumulation of heat during the householder years, that we've talked
Yep.
about. It's really this fire, this inflammation. And, you were talking about ancestral foods. How do we, what are some things that maybe we could start to think about as a way to sort of cool this inflammation,
Yep.
cool this fire in that perimenopause, menopause stage of life?
So this is where I say to people, herbs. Herbs can be incredible. And folks are like,
Hmm.
well, what do you mean an herb can be incredible? I mean that herbs have the ability to add flavor, but also phytonutrients,
Hmm.
antioxidants to your plate without the need or minimizing the need for the added sugars, the added salts, and the fats.
Right.
We've
Hmm.
kind of been taught that, like, oh, salt and pepper is enough. And for
Hmm.
some people, if that's your palate, fantastic. But I actually
Hmm.
do say to people, and if you can tolerate garlic, some people need to really have it cooked. Some people can only have it in oil, depending on
Hmm.
what's going on. The allium,
Hmm.
so that's your onion, your thyme, your parsley, your chive, your sage, like
Hmm.
all of those herbs, they can show up in your animal proteins. They can be added to rice. Let's say you want to do a dill rice. You can have an
Hmm.
entire bunch of dill and you put that
Right.
in your rice, and that is
Hmm.
unbelievably flavorful. There's so
Hmm.
many seeds. So my family is Afro-Caribbean. So we would grow up doing things like curry chickpea and curry potato because that's what they did in Trinidad and Tobago. And so it was turmeric, it was cardamom, it
Right.
was thyme, it was bay
Hmm.
leaf being toasted and seasoned in the pan, black pepper. And the research now we have actually says, oh, when you put curcumin and black pepper together, it actually makes the antioxidants more bioavailable. And it
Hmm.
is really incredible.
Right.
So it's like, those are the things that I say to people. Like, if you can get back to some of the foods that you grew up with. Here's a perfect example. I had a patient who is Russian and somehow thought that having their traditional foods was no longer on the table. So they said, oh,
Hmm.
I didn't know that I could have like borscht. I didn't know that I could have some of those pickled and fermented foods. I thought that I
Right.
should only have brown rice or only have
Hmm.
quinoa and
Hmm.
steamed vegetables. And I said, no, those foods are incredible. I
Right.
said, that's probiotics, that's prebiotics, it's
Hmm.
phytonutrients. Those are anti-inflammatory foods.
Right.
And the combination of eating something that actually feels like a warm hug is like a
Absolutely.
relaxation in the body.
Yep.
And so I do say, really look at the flavors that are coming onto your plate and those herbs and spices. So
Hmm.
that's one with the ancestral foods. The other thing that I've noticed, and this is, I wouldn't say across the board, but I've seen in many cultures, there are a
Hmm.
lot of warm dishes, a lot of soups, stews, combination dishes that have maybe a legume, a herb, and some type of brothy base. Those things can be wonderfully hydrating, and they can also be an excellent way to add nutrition to your pattern of eating. So look at
Right.
those soups and stews, how to get more of those onto your plate.
Yeah. Yeah. And I mean, a lot of the things you're talking about are very in line with Ayurvedic principles, which is, this idea of favoring pitta pacifying foods, which are, things that will decrease fire, bitter, astringent taste. You want to avoid sour. And spicy foods. So, when you're talking about herbs, I want to make sure that people understand that doesn't mean spicy. It just means more flavorful, and also you have all those phytonutrients in the herbs. That's what we're really sort of getting at here. And so I
Absolutely.
think that that's really important. One question that I get asked a lot, people will talk about specific symptoms that they're having when they are entering perimenopause and menopause. And we both know hot flashes are like the big story. Everybody's
Right.
always talking about hot flashes, right? Because that's sort of the hallmark. That's the one that, irritates women the most, and it's very difficult to deal with. Are there any foods or habits that you have seen or that you will suggest to patients that either make, hot flashes worse or maybe things that could help to reduce the intensity. Are there any things that you've seen that kind of help with that?
Absolutely. So alcohol, number 1.
Yeah,
Like, that's a huge so many of my patients, number 1, they talk about not being able to tolerate alcohol anymore, but
right,
then number 2, they talk about when they do consume alcohol that they tend to have more hot flashes, and we know that hot flashes are vasomotor, so there's, like, a shift in your blood pressure that's happening,
right,
and that's part of why you feel that, like, warm flushing sensation.
right,
So I definitely say decrease in alcohol. It's also going to help with sleep quality, which is very important
right.
in the midlife years. I
Mhm,
love the householder terminology. And then
mhm,
the other thing is if we know that there's kind of a decrease in these protective hormones, then we
right.
also want to begin to eat like we're in a pre stage. And I'm really careful when I say this. I'm not saying that anyone has pre-hypertension, but I am saying the 3,000 milligrams of sodium that the average person living in the US consumes per day is a lot of stress on the cardiovascular system.
Mhm,
So maybe, and the recommendation is 2,000 milligrams. Maybe
mhm,
there's a possibility in this time to actually pull back on the salt. Like if you're having anything in a package, read that package good. Look for things that are labeled as low in sodium. So if you're trying to get a can of chickpeas, look for the ones that are low in sodium or rinse them. You're going to cut 40% of the sodium, but
right,
really start to pay attention to your sodium intake because that's like an assist,
right.
right? We want to actually support and help our body so that it can work in tandem. So give
Mhm.
your body the assist, reduce your sodium intake. That can be greatly helpful with regard to, for I've seen with many of my patients, like helping with kind of the high, low blood pressure that they sometimes experience.
Yeah. I mean, there are so many studies that show that, the triggers for hot flashes, things that can just exacerbate them are the caffeine, the alcohol, the spicy foods, the ultra processed foods, right? These are all known triggers. There have been numerous studies that show that people who are eating more of those types of foods they have much increased intensity of their hot flashes, right?
Yeah.
So it's in line with what you're saying.
And the other thing that I wanna say, because sometimes people get a little confused, they're like, "Well, wait a second, what's ultra processed?" Because, like, soy milk falls into being ultra processed,
Yes.
and so does a protein powder. So what we're
Mhm.
really talking about is being mindful of the foods that have high amounts of added sugars, added fats, and added salts. Those are the things, lots of additives in them. And the reason that we don't like those to be the center of your plate is because they don't serve you on a cellular level, right? It makes it harder for your body
Right.
to stay in balance.
Right. And so you mentioned soy and some of the foods that, can be good or bad, right? So I wanted to ask about that. Like, what's your perspective on soy, isoflavines? Like, how does that affect hot flashes, estrogen? Like, what's your take on that for perimenopause, menopause?
So, yeah, so I've read a couple of studies and I'll be able to share them with you for the show notes. And I
Hmm.
actually went to a soy retreat, which was really interesting and
Hmm.
got to meet some soybean farmers.
Hmm.
And interestingly enough, it seems that soy in its whole and minimally processed form is
Yes.
actually really beneficial.
Right.
The reason I say in its whole and minimally processed form is because I'm not talking about a soy chip. I'm not
Right.
talking about a soy bar. I'm talking about like tofu or tempeh,
Right.
like in its whole and minimally processed form. And that's the case in general, right? So when
Mhm.
people are eating whole foods more often,
Right.
then the outcomes tend to be better. And as I say that, I'm fully aware that access to whole foods is a major challenge in the US. So I'm
Correct.
asking for something that has now gone from being an innate human right to something that is like a privilege. And this is why I say to folks, you've got to become savvy and shop that entire grocery store because
Right.
you have to find the foods that are in the minimally processed form in the center that don't
Hmm.
have the additive. So it's like
Right.
if you're not going to take a bag of chickpeas from being dry, then you need to find the can that is just chickpeas or the box or the jar that's just chickpeas.
Right.
And that's what that's what I work with my patients, right? Like, how
Mhm.
do you create the plate that you want for yourself in this midlife? Because
Mhm.
there is a prescriptive nature that food has. I'm not going to say
Right.
that it's curative. I'm going to say that it's adjuvant therapy, meaning that it can be by side. Like, you've got to engage in all the other things, the lifestyle modifications. But
Right.
there is a way that food can be prescriptive. And the research does say that if you are in a pre-stage of pre-diabetes, pre-hypertension, or having borderline high cholesterol, that nutrition and lifestyle shifts can have a similar outcome to a low dose pharmacological agent, meaning you could take a low dose medication
Right.
and have a similar outcome if you engage in prescriptive nutrition behaviors. Again, all the variables have to be in place and you need the access and all the things. But that's where I say this is not about being punitive. This is about saying, how can we help food serve your body so that you can actually enter into the fifth and sixth decade in good health and not be having multiple chronic illnesses?
Right, right. Yeah, I think that that's such an important point that you're making is that, this sort of this perspective of, what are the things that you can do to decrease the pre of any kind of disease
Yep.
goes along. It's not just about perimenopause and menopause, but it's
Right.
overall health. And I hope that that's really what our listeners are hearing is that, yes, we're all concerned about the perimenopause, menopausal symptoms, but it's actually so much bigger than that for our overall health, which actually kind of leads me to the next question I wanted to ask you about, which is about heart health. Like, let's get into some of the specifics that, estrogen again is protective
Yes.
for our heart, for our bone, right? And I
Yes.
know that this is a big, when women are making decisions about what therapies they're going to do, are they going to do hormone replacement? Are they going to, this is a big thing that comes up is the protection for your heart, for your bones. I've even had the conversations with my doctors, right? So, as estrogen declines, right, you have an increase of you have an increased risk of heart disease
Yes.
because it's protective for the heart, right? What are some heart protective foods that women can start to focus on as they're going into this stage or even the pre stage, right?
Yeah.
Like to protect their heart? What would
Yeah.
be some foods that women could really think about?
So the first thing that I say, and I usually start with the positive, but this is actually
Mhm.
where I'm going to start with the steer clear of. And the reason I'm going to
Okay.
do the steer clear of is because this is trending right now
Sure.
across the internet. This is not a stage where you should be engaging in eating high amounts of saturated fats. So, like all the recommendations around having sticks of butter as a snack,
Wow.
I mean, it's out there, it's happening, and then I'm having to say to my patients, "No, you can't have a stick of butter as a snack. You can't have butter sprinkled with salt and think that that is going to actually be okay."
Mhm.
We want to keep your cholesterol and your blood pressure within normal limits.